Well, we've been dealing with multiple respiratory infections, including COVID, whooping cough, or our RSV. But influenza cases, they are also on the rise in areas like the U.S. For a look at that, we're joined by Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Good morning to you, doctor. Nice to see you today.
Great to see you as well. Thanks for having me on.
You know, I'm wondering, this rise in some cases that we're seeing in things like COVID, the flu, RSV, is that just kind of a seasonal thing? Anything unusual we're seeing there?
Yeah, it absolutely is a seasonal thing. What's interesting is the influenza season, it's certainly here. It's definitely picking up and gaining steam. It looks like it started a couple of weeks later than it normally starts. But it is very much here, and we'll be unfortunately seeing a lot more of this in Canada. Same with RSV. The interesting thing about COVID is, we know COVID transmits year round, but there's times of the year where we see more of it. And remarkably, we're not seeing as much as we would have thought we would be seeing at this time of year. Listen, we're probably still going to see a rise in cases at some point throughout the winter. I think many of us thought we would have seen it by now, and it's still puttering along.
You know, I'm thinking of like family chat groups and that kind of thing. People saying, I'm not feeling so great. I think I've got the flu. I think I might have this. When do you know that it might be something serious? You might have to go to a hospital for some more help.
Yeah, so great question and great point. I mean, it's very difficult to distinguish many of these respiratory viruses from each other just with clinical symptoms alone. Sometimes there's clues, but very, very little is definitive based on just the clinical spectrum. But regardless of the underlying illness, if people are having difficulty breathing, if people are so unwell that they're unable to care for themselves or have significant risk factors for more severe disease and they're on a downward trajectory, of course, go seek help. We always hear about healthcare in Canada being stretched, but listen, there is a dedicated team of healthcare workers across the country, day and night, on holidays, at all hours of the day, who are ready and very capable and willing and to care for the Canadian population, and will do a wonderful job doing so.
And we keep talking about, walking influenza, that kind of thing. Is that something that's still being seen right now? Walking pneumonia,
so this is something,
walking pneumonia.
Right,
sorry.
Yeah, exactly. Yeah, no problem. That's why we're here. Yeah, that's a bacteria called Mycoplasma pneumoniae, and the colloquial term is a walking pneumonia. It can still be a severe infection. It's called walking pneumonia because a lot of the time people who are infected with this aren't walloped and on their back or in the hospital, and they're walking around. They feel crummy, but they're still walking around and is still able to go about their day. But make no mistake, it can still have a severe infection. There is a rise in cases of this in Canada now, of course, in the United States. Too. And, this is something known to cause outbreaks from time to time. China, for example, last year had a big outbreak. France last year had a big outbreak. It's known to cause that. It's the interesting thing with this is it's typically a younger cohort that's disproportionately impacted by this. And sometimes with kids, we use a conventional antibiotic. It's called amoxicillin, very widely used antibiotic in children. But with this particular bacteria, amoxicillin doesn't work. There's many other antibiotics that work for this, but amoxicillin isn't one. So most family physicians and other frontline healthcare providers, if someone has pneumonia and they're in the younger cohort, they're using other drugs to treat this empirically. You can get a test. It's not hard to diagnose, but do you really want to wait 2 days for that test to come back? You can usually start empiric therapy with an appropriate antibiotic on site.
Listen, switching gears a little, love them or hate them, people are setting New Year's resolutions this time of year. I wonder, as a doctor, if you want to see people healthier, what kind of resolutions would you like to see them set?
Usually I get on here and I talk about infectious diseases and public health and really focus on emerging infectious diseases. But let me veer away from that for a second. And, I really think a healthy diet, a good night's sleep, and excellent exercise regimens, be it cardiovascular and weight bearing, all three of those does so much for mental health and for physical health. And I think those would be good resolutions. Easy to say, but come on, that takes a lot of self-discipline and self-control to really ensure that there's consistency. And listen, we can do it. We can do anything we put our minds to.
Well, and I guess there's a reason why we hear that from healthcare professionals all the time. Do those things you keep telling us to do. Listen, Dr. Isaac Bogoch, we appreciate you coming here and joining us today, and happy early New Year to you.
And to you as well. Thanks for having me on.
I appreciate it.